We're going to move to our next segment via Skype. We've got Kara Jones visiting us. She is a visiting fellow at Independent Women's Forum. Hi, Kara.
Hi, Carrie. Hi, Alice. Great to be with you guys.
Great to be with you. A few Democrats have been introducing Medicare for All bills, including Senator Bernie Sanders and Rep. Pramila Jayapal, and it's popular among the 2020 Democratic candidates. What do you think are the chances of a single-payer healthcare system being passed by Congress?
As of right now, it's pretty politically infeasible to pass Medicare for All. We have a Republican in the White House, and our Republicans control the Senate as well. But it's notable how much traction Medicare for All, which would be a single payer healthcare system, is really gaining. And you mentioned the presidential candidates. At least 7 of the 20 odd presidential candidates that we have for the Democratic nomination have endorsed some sort of single payer proposal. And also, when we look in the House, just a couple weeks ago, we had our first ever hearing on Representative Jayapal's Medicare for All bill, and 107 Democrats signed on to that bill, which is about half of House Democrats. So it's really gaining some traction.
And what about the fact that when you pull the concept of single payer, people, without knowing the full details, that it means nixing your private insurance, once people understand that, the number goes down of people who want to participate or that they would be interested in it. Do you think that part of the traction that you mentioned is because there's a lack of education?
Absolutely. You know, Medicare for All, that phrase sounds really good because, of course, everybody, both Republicans and Democrats, want to make sure that all Americans have access to high quality and affordable health insurance. Nobody would disagree with that. But the way that we get there is very different. So when we look at polling, Medicare for All, that phrase polls really well among Democrats and Republicans. But when you dig a little bit more into the details, and when the voters are told that Medicare for All, a single payer healthcare system, could lead to delays in accessing healthcare, it would lead to massive tax increases, and it would eliminate the Medicare program and Medicaid program, as well as private insurance as we know it. Support drops precipitously.
I have to confess that I'm a big supporter of Medicare for All.
Shocker.
I know, and I do think that the strategy that Bernie and Pramila are putting forward have to do with a North Star, right? Like, this is where we're starting. It's actually art of the deal, right? You're kind of you ask for the most that you can get, and then you're going down from there. And this is an ideal system that obviously you have to break down the details of. And yes, we should. This is one of the things that I agree that we need to have a discussion about. We should talk about waiting times, whether that's going to increase. We should be talking about taxes, but it's fundamentally about whether most people will be better off. And Republicans have been very good at talking about how, your taxes are going to increase, so then that means you're worse off or that you're paying more, when in reality, if you break down how much Americans are spending for healthcare, or you break down the amount of people that don't have healthcare, and that 45,000 people a year in this country die, allegedly, according to a study from Harvard from 2013, then I think that is where you see a lot of that support. So I would ask both of you, what is the alternative?
Well, one thing that I would love to get your take on, Kara, is this question of prices, because I think this is an area of bipartisan agreement that, and I know Independent Women's Forum, you guys have done a lot on this, that there's a lot of lack of transparency in the healthcare marketplace, so that a lot of people, they don't know what they get a procedure, they go to the ER, or they get a routine surgery, whatever. They don't know how much it's going to pay. Or have to pay, what's out of pocket, what are the deductibles, what are the additional costs. It's all hidden, it's all in the dark. And so if we're all trying to save money and we're all trying to save lives, wouldn't we want to have more transparency in pricing? And my concern about government distortion is that when it's only one payer, there's not competition.
But the whole point is that if the government is the one that's negotiating and the consumer doesn't have to negotiate, then prices will go down. That's the whole point. Like, that right now, it's not affordable. And if you have you have somebody with so much leverage because they're covering all of the United States, essentially. And it's to your point, because it just came up for me. I think the most egregious manifestation of what you're talking about with not knowing about pricing was recently, for example, I read a medical bill from a woman that had just given birth, and the hospital charged her, I believe, $72 to have her child be put in her chest. And so anyway, these are some of the points that we're talking about. But I think the greater point is that why have so many countries across the world, most developed countries, been able to adopt single-payer healthcare and have better outcomes in healthcare than America does?
Carrot?
Well, to that point, Alice, it's important to note that what's being proposed by Senator Bernie Sanders and Pramila Jayapal, it's a lot more comprehensive than the single-payer universal healthcare systems in other countries. For example, the Sanders bill would cover dental and vision care, whereas the single-payer systems in Canada, in Australia, in the Netherlands, they don't cover these services. Senator Bernie Sanders loves to talk about his love for the Nordic countries, but when we look at their universal healthcare systems, they're really struggling to keep up with the cost too. We've seen Denmark has recently raised the retirement age to 73, which is the highest in the world, to help pay for healthcare insurance for their citizens. Sweden recently opened up parts of its healthcare system to the private sector to increase efficiency. And in Finland, just in March, the entire cabinet had to resign over their failure to pass healthcare reform. So they're having trouble in other countries as well. I agree that prices are a huge deal in the US. So we've seen just last week, Gallup poll released a poll saying that the number one concern that American voters have is the rising cost of healthcare. So we need to do more on this. I think that the left, their solution for this is to set prices. So the government should come in and enact a single payer system where the government is the only payer of all medically necessary services. But on the right, the conservatives are saying, no, we really need to expand on this idea that Carrie touched on, which is price transparency. Let's make a real healthcare market, a free market in the healthcare system, which does not exist to this day, and give patients the information that they need to make decisions about their healthcare.
All right, Kara Jones, thanks so much for joining us. We always appreciate the debate.
Thank you both.